Hi, I'm Dr. Julie Steinauer, and today I want to talk with you about Syntonics and what does it look like if you do this from home. Now, before I do that, I want to tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you've got a couple choices. One, you can fill out a questionnaire and get some kind of general feedback about your vision, or two, you can schedule a consultation directly with me if you just know that you're ready to take that next step in improving your vision. Now let's go back and talk about what does it look like if you're doing Syntonics at home. So we have these little lamps that we recommend. You don't have to use this type of a lamp, but of course it makes it easy if you have something like this. These lamps are purchasable at like a home goods store, also from Amazon. And what you do is you, about $15 from Amazon. The main thing is that the bulb needs to be an incandescent bulb and not necessarily one of those LED or spiral types of bulbs. Now, if you happen to live in a place in the world or in the country where incandescent bulbs are not something that you can use or find anymore, that's okay, because there are other options. You can actually use some natural light halogen bulbs and some other things that we can recommend for you, depending upon, again, where you're located. Now, we're going to set it up using this type of bulb and this type of device actually, and I'm just going to show you what does it look like when you're doing this at home. So I'm going to take my glasses off. Oh, I hope I can see. And I'm going to put on the first round of filters that often we prescribe for our patients. It is kind of a brain healing filter. What you do, and I'm hopefully going to hold this up and I'm not going to knock anything over or knock my cameras or anything, so bear with me. So we're going to put the glasses on. You'll have the light bulb on, which I don't have it on, just so we can not blind me with that right now. But you're going to sit about a foot to a foot and a half away. And you're going to be looking at the bulb with the glasses on. We're going to ask you to do things like look up and down, side to side, diagonally, go around in circles, clockwise and counterclockwise, and take periods of rest too. You're not there to zip zap your eyes all around nonstop. But for 2 minutes, you're going to wear the first filter, or for as long as we prescribe for you, depending upon what your visual condition might be that we're working on. When your timer goes off, you'll take these goggles off and you'll put on your second filter. That filter might be actually something associated with alignment of your eyes. So for instance, I'm going to put on a filter that's more for alignment of the eyes. Typically this one, which you can't really see it. Actually, can you? Let's just try. Can you see that? That, if we're able to see that on the camera, is a nice green color. So you wear this filter. It might be green or it might be more blue-green. Can I get it to fit on my face? Hello? Okay. So you wear this filter for 5 minutes and you would proceed to look at the light again. At the end of that 5 minutes, you're going to take the glasses off. Now that might mean that you're totally done and you're finished with your Syntonics for the day. But if we happen to have you on 2 sets where we say, okay, there's another one that you need to do, then you're going to go back 30 minutes in between. You're going to let some time lapse or go by. You can go take a shower, you can go do some work, you can read a book, you can take a nap, you can go to school. So at least 30 minutes has to pass between set number 1 and set number 2. And then what you're going to do is you're going to put the other glasses on for a couple of minutes again and look at the light. Okay, I'm not going to bring that back up again. And then you'll take those off. And then this time around, you're going to put on the yellow goggles. And the yellow goggles, like this, you'll wear those for a couple of minutes. And I think you can easily see that on the camera. So that's kind of how it works. During the time that you're doing this, you are again moving your eyes up and down and around in different areas so that your brain is stimulating your eyes on how to align. And then secondarily, also what we're looking for is we want you to stay mentally active. So we call it cognitively active. That might mean that you run through grocery lists in your head. You might spell words. You might perform math facts. You might listen to classical music. Or you might do something like actually listen to an Audible book. So those are great things to do to keep your mind mentally active. Now, what if you happen to have a child who's super busy and does not like all this sitting around and staring at a light? Well, in those particular cases, what you can actually do is now you can have them do something really fun. They can go to a window or a door that has a window or glass on it. Use those vis-a-vis or kind of like erasable types of markers. And because of the ambient light coming in the door, they can be drawing and doing doodling on the door during the time. You can be in the background with your watch kind of, or your iPhone, and watching the time and telling them when to switch filters, but it will pass the time much more quickly for them if they get to do something kind of fun while they're doing it. Now, if you want to know how do we handle this if someone is even younger, like our infants or toddlers that we work with, and maybe they don't want to wear the glasses at all. Well, we've actually made videos talking about the surrogate Syntonics method that we utilize for our younger patients. And you can probably go check out one of those videos, or maybe we'll drop it down in the comment below. Now, if you like this video, hit the like button. Make sure that you subscribe to our channel. And also, what I would say is just remember that if you're local, give us a call at 618-288-1489. If you're not local, it doesn't mean that we can't work with you. We need to do a couple of things in order to make that happen. And what you'll want to do is you'll want to go to our website at visionforlifeworks.com and click on the schedule a consultation button and schedule a time to consult with me. As always, the way to end this video is just to tell you, if you feel like someone could benefit from this, maybe you know someone who's doing our program and they're doing Syntonics, or maybe it's just someone that you know is in another vision therapy program and you want them to see our video, please pass this on. Thank you.